so that we've got everybody as they arrive as well. But we might like to make mention of that. That would be lovely.
Hi, Colleen. Oh.
Hi, Colleen.
Bear with me 2 seconds.
There you go. Hi, how are you?
Actually, Michelle, maybe it's worthwhile asking people if they're happy for the recording to be loaded onto the Facebook page, because it's a public meeting. So if people are happy to do that, it's no reason why they couldn't get a link to it and see what happened. So, I mean, I don't know, people might object to that, but if they don't.
How have you been, Colleen?
Fine, working. Back working, so that's good.
That's good news.
It's just been nicely ticking over, so that's good.
That's good news.
Yeah. It'll be great when Melbourne opens up properly, but we're getting a lot of visitors.
We're close.
Yeah, I know. Here's hoping.
How are you feeling down there in Melbourne with your bit more opening, Alison? Is it exciting?
Yeah, it's people are a lot more optimistic, I have to say. It's particularly the last few days, the numbers have dropped so quickly. Like we were bobbling along at sort of 10 to 15 and suddenly we're at 1 and 2. It's like, wow, how good is this? So I think there's some people disappointed that we're not opening faster. And, you know, fair enough. I tend to think, let's just take this a bit slowly and see what happens. Because it's only a couple of days ago we had 15 cases. So, you know, and on any day, your cases are an indication of what happened 5 to 10 days ago. So, you know, I personally still think we're just a little bit fragile, but hopefully it's and when I reflect on a couple of months ago when, you know, 700 cases a day and it was truly awful, you know, just people dying, you know, it was really, really hard times. It's I think people are generally feeling a whole lot better, and I think even the debate over how fast we should open is a healthy thing. It's an indication that people are feeling a bit more optimistic. They're starting to think about the future. That's, you know, that's good. It's good.
Yeah, I think so. So let's see, who have we got here? I've got Chanel, Cam. Hi, Cam. Welcome. I'm Anne. Thanks for coming along. And I've got Callum there. Hi, Callum. I can see you.
G'day. How are you going?
Yeah, good. Thanks. Welcome.
Thank you.
I'm chairing this meeting, so it's great to have you join us. Really appreciate that.
No worries.
So we got I've got Sharon. Sharon is just, and is that who's that there called iPhone? Is that you, Steve? Is that
Scott Simons from Mandalay?
Oh, I'm sorry, Scott. You've become a Steve. How rude of me.
So, Scott, you've got your phone on now? Which one's Scott?
Scott's iPhone.
I'll go off mute now so you can probably hear me.
That's great. Who is anyone that I've not? Hi, Chanel. So say hi now. Who else have we got? We've got Melanie joining us as well. Welcome, Melanie.
Hello, how are you?
Good. Thanks for joining us.
Pleasure.
That's fantastic. Is there? I'm sure we'll have a few other people joining us. Now, is there anyone else now who hasn't said hi yet? I think there's Alison over here.
Xavier, maybe? Have we said hi?
Oh, Xavier. Hi. Hi, Xavier. Thanks, Chanel. Welcome. Thanks for coming along. I think Colleen, we've already said hi. And Gerard, we said hello. Michelle, our indefatigable support in all things, and Alison, our facilitator today. Yeah, thanks all very much for coming along today. Welcome to this session. Yeah, my name's Anne. I sit on the Heathcote Health Board, and I'm chair of the Community Advisory Committee. And I'm supported here today by my fellow directors, Gerard and Chanel. Thank you so much for coming along, and Michelle, who supports us here. Also, we've got some members of our committee. So Colleen and Scott there. Thank you for coming along. I'd like to welcome you all today. We're looking ahead, but the first thing I'd just like to do is just acknowledge that we're welcoming on. We're holding this session. Well, I'm holding this session on Jara country, and acknowledge the Jajarung, who are and their leaders, past, present, emerging. Oh, I lost you there for a minute. I hope you heard my acknowledgement, and I'm sure that we're representing different lands all around Victoria, and I'm sure that we've got the Tungarung, the Wadawurrung, and many others. Sorry?
The Wurundjeri.
What, Wurundjeri? Oh, great. Yep. Glad that we've got that. And if there are any others, then shout out. Thank you all. Oh, I think we've just had Bron join us. Welcome, Bron. Good to see you there. Thanks for coming along, and I'm sure we'll have a few more as people manage to grapple with the technology. So yeah, thanks and welcome for coming today. Heathcote Health are starting on our strategic planning for the next period, and it's really important for us to get the voice of our community, to understand what's important out there, to listen to our stakeholders, so that when we're doing that high level strategic planning about what we're focusing on and what we're trying to achieve for the next 3 years, that we've heard the voices and we know what's important to people, and we can try and put in place the plans and the resources and the direction of the organisation to try and achieve that. So that's what I think we're here for today. And it's not going to be me doing the work. I'm going to be handing over to the fabulous Alison Hallahan, who's managing this project for us. She's talking to various different groups and talking to boards and talking to stakeholders, most importantly our consumers, to make sure they're at the heart of everything we do. So I think if I've covered everything, Alison, I'll hand over to you.
Thank you, Anne. Thank you, Anne. And it's lovely to see you all. We've scheduled this meeting for an hour and a half, but I acknowledge that it's very exhausting for people working in this, the Zoom environment. So if it doesn't have to take an hour and a half, if we're finished by then, we can just finish. But it's partly my job to make sure that we don't go over the hour and a half. That's all the time you've given me, and so I'll respect that and make sure that we finish by 7 at the very latest. So what I'd like to do, sorry, I should explain who I am. I work with a small consultancy firm called Biru. We do a lot of planning and commercial advice work across Victorian portfolios. I lead the health department within our firm, and we've done a lot of service plans, strategic plans, business cases across metropolitan regional health in Victoria for a long time. I actually had the privilege of working with Heathcote Health a few years ago to do the service plan that you're currently working with. I've had the pleasure of working with your organisation before, and it's a great privilege to be invited to participate again. Michelle's put up the agenda. So what I would like to run through is to start by talking about the environment for you as stakeholders within the health service. So what are the things that's impacting on the health service, on the community, on your people within the community? You might be a business representative, or you know, a user of services, or it doesn't matter. So what are the factors that you're seeing impacting on you, your community, and your stakeholders within Heathcote? Then we'll go from there to talking about Heathcote Health. So the current strategic plan, which is due to run out next year, emphasises community awareness, workforce, appropriate service delivery, appropriate service planning for effective and efficient service to the community, engagement with the community, good governance, safety and high quality. So I want you to reflect on those priorities and just think about, you know, what does that mean for you? Are they still high priorities? Are there factors that we would jointly prioritise differently now, given some of the stuff that we'll go through in the environmental scan? And then we'll think about who are the people, what are the resources that are available to Heathcote Health to respond to those community factors, and to think about itself and how it works with the community over time. I've noticed that people have started using the chat box, so feel free if you're not necessarily wanting to pipe up, but you want to say something, feel free to put it into the chat system so we make sure that it's not lost. At the end of the night, I'll invite you, if anybody, I'll say to you, if anybody's come with something specific that you want to say and you haven't had the opportunity to say it, that will be your opportunity to put your hand up there. There's another of these meetings tomorrow. There's no expectation that you come to both of them, but of course, if you want to come to both, you're very welcome. We scheduled, one for the evening and one for during the day, because different people find an evening or a middle of the day time more accessible. So that's hoping to spread out the number of people who can be involved. So I'm going to start by asking you to reflect on, what's going on for you as individuals and as members of the community or groups within the community in Heathcote that you'd like Heathcote Health to know about and take notice of as it starts to prepare its next strategic plan. We did start talking before about the pandemic. Does anybody want to start off maybe with that as it's such a topical issue at the moment? What's it meant for you as a community? How has it played out there?
Alison, I'm happy to start the conversation, but very conscious that I'm not actually embedded in the Heathcote community. We work with Heathcote Health, so I'm from the Royal Flying Doctor Service.
Oh, great.
And we run the community transport program in collaboration with Heathcote Health. But from our perspective, what we've seen in terms of the response to COVID, there's had to be a lot of flexibility. There's had to be consideration for how people are feeling about attending health appointments or actually just being out in the community in general. And I expect that's something that we're going to be dealing with on an ongoing basis. There's had to be education for people around how to keep themselves and others safe, and it has required changes to service delivery. And again, that's probably going to be ongoing impacts. We work really closely with our team of volunteers, and one of the things we have seen is that the volunteers are very keen to keep working on the program, but a lot of them are in what we'd consider a high risk category. So that might be some of the things that we also think about going forward, is how do we keep those volunteers safe and still keep them engaged, because it does have good impact for the community. It does build sharing and knowledge within the community. So it's not just about delivering a service, it's about what it gives to the volunteers and their wellbeing and the connections that they build with the service users.
So Melanie, what sort of roles are your volunteers playing?
They're actually drivers for the vehicles. Yep. And so they've worked very, very closely with the team at Heathcote Health on, maintaining good infection prevention and control. We've worked around social distancing within the vehicles. So I think, these are some of the things. And for us, it's going to be about how we work with Heathcote Health and the other health providers in the area to get the message through to people that it's okay to attend your health appointments. It's actually really important that you do. Because it's going to potentially impact further down the track if you don't. So, I mean, specifically, they're the things that we've seen. From a larger Royal Flying Doctor perspective, what we have noticed is, or what we've been told, is that funding will be in short supply. So a lot of our programs are funded through donor funding. So for us as an organisation, our traditional funding streams may change. We'll be looking a lot more towards corporate partnerships. And Heathcote Health has been really good at helping to facilitate those discussions, but I expect there could be more of it. And having multi-year funding agreements with those corporate partners as well. We've also heard that philanthropy in terms of trusts and foundations, there'll be very little coming through from them probably over the next 18 to 24 months. Yeah,
it's interesting. There's going to be a lot of call, I think, on those sources of funding, and potentially they're going to find it more difficult to keep their donations rolling in. So I was just going to say, so that idea of, partnering and really working hard together to identify funding sources is something that we really value with Heathcote Health. It's a very good partnership in that sense. Michelle is on top of things and always sends through opportunities to us. We're not always successful, Michelle, but we have a crack, don't we? You've always got to ask.
So I guess for us, that's going to be a very, very important component going forward. Also looking at how we use the funds that we have together most efficiently. How do we streamline things and really get the most bang for our buck? And I think COVID's going to force us to do that even more.
So anybody else want to reflect on that? Have other people had that same experience where the people you're working with are nervous about going to appointments, going into the community? Is that really changing the way that individuals and groups are operating?
Certainly, I found there has been a lot of talk at work, people coming into work not wanting to attend appointments, as Melanie has. because they're scared. I think there has been a lot of hype, and people are scared, and unnecessarily scared, I think, in a lot of cases. So now that we're coming out and people are even nervous of Melbourne opening up and Melbourne people coming into our region.
Yeah,
and,
I get that.
I think that in itself, all that scaremongering has certainly affected people's mental health as well, has been a major, there's been a major impact locally.
Yeah.
And even amongst my staff, there's been a lot of mental health. There've been a lot of mental health problems.
Yeah. How's employment holding up? Are people losing jobs?
Our business, we're in a fortunate position, I guess, but where we've managed to, that's where the JobKeeper was, we were really fortunate, JobKeeper. But going forward, I think there are a lot of businesses, there seem to be a lot of businesses, cafes, and businesses in Bendigo that we know are not going to be opening. Unfortunately, and then the roll-on effect from that will be quite devastating, I think. Yeah.
And is that mainly about people's income? I mean, we do know that one of the real factors in people losing that sense of mental health and well-being is loss of a job.
Well, loss of hope. I think there's just that loss of hope, that hopelessness, because it's, you know, they've had a job and now they don't, and where are they going to get a job? Jobs are going to be difficult. Especially, and I'm speaking mostly from the hospitality
which has been very badly affected.
Which has been very badly hit. And there are a lot of, frightened people. Out there because they don't know that they will get a job again, and especially in hospitality. Going forward, or it'll be a while before they're able to. So that definitely has had a major impact mentally for a lot of people, and business owners as well. You know, not coming back, and feeling really bad for their workers. Not being able to re-employ people, not being able to re-employ the amount of people they had before. The repercussions of all that, people losing their jobs, is quite devastating.
And so will people sort of start looking for jobs further afield? I mean, we've in a couple of the discussions I've had, people have talked about Heathcote as potentially an area that will attract population because of some of your natural benefits. Do you think, is there going to be a sort of almost a competing change of people having to go to, say, Bendigo or somewhere else to get work?
Sorry, I'm hogging it at the moment.
No, it's interesting.
I was speaking to one of the estate agents today. Locally, and he was saying houses are just not even hitting the market. They don't even go on the market, and they sold. Bendigo houses are going really fast, and here in Heathcote, houses on market and are sold within.
Right. Okay.
Whereas, you know, 5 years ago, a house in Heathcote would take a couple of years to sell. Now they're just flying out the door. I know there've been a number of families who are from Melbourne, had their holiday home up here, now moved up here permanently. So, I mean, that's great for our region.
Yes.
And I don't think locally in Heathcote, I'm just trying to think, but I don't think any of our local businesses have gone under. Oh, no, actually, yes, there have been a couple. But no, there have been a couple. I beg your pardon. Flossie's has, and I can't think of anybody else at the moment, but there've been one or two. But overall, I think we've managed to keep going, most people.
Yeah, good.
Oh, that's
And
good.
the other thing, that the other string you have to your bow, of course, is the wine industry, which is, you know, it's one of those industries that attracts people.
Well, it's also the wine industries have had a lot of grants in this last year.
Yep.
A lot of money's been put into the wine industry here in this region. So there are a number of wineries who are opening up cellar doors, which they didn't have before. So from that point of view, absolutely, that's on the rise, which is great.
Yeah.
For our region.
And so
Hi. Sorry, Colleen, I'd like to support some of the points that you've raised there. Thank you. I think some people are moving, like you'll have transition into the region because people can work remotely now. An appreciation for working in the CBD of Melbourne and having to live in Melbourne has altered, which possibly means that I'm hopeful that means our hospitality industry will bounce back quicker, because you've got a change in population occurring in that space as professionals move and live to Heathcote and still want their cup of coffee and their boutique beer and cakes and slices and all that sort of stuff. So I think what you'll find is that we're potentially in a lucky space with regards to tree changes coming out of Melbourne, as long as the support services exist. So as long as infrastructure such as the internet is reliable. And yes, and that hasn't been the case. As I'm quite excited, I've managed to log on from home, which is not always the case for me. And those support services around that, so that the childcare centre continues going and after school care centre continues going, so that people do have that freedom in and around that space. And, you know, for the business savvy, there's potentially new opportunities that exist with that tree change occurring as well. So I think, you know, we're possibly a little blessed to recover a little bit quicker than other regions. You know, I'd hate to own a business in the CBD of Melbourne that used to thrive on massive numbers. I think there's going to be a mass exodus there. But I also want to support Colleen's statement in and around mental health. I think that's going to be such a big driver and such a big killer. You know, I think I myself have witnessed similar things with our staff regarding just working from home. They've had their job, they've just had, there's been I don't know, maybe it's because we're social beings. I'm no medical person here, but there's just been a decline in tolerance and acceptance. And absolutely, the media has created so much fear in people. So it's not necessarily loss of job, but what COVID might do for them and how it would impact them personally, and the unknown, the fear of the unknown in that space. So I really think Heathcote Health has a massive opportunity in mental health to provide education around resilience and around what mental health looks like, potentially connecting in with the primary school children. I'll just speculate here, you know, educate our youth and you end up with societal change in 20 years' time. So, and I think back to the internet comment, I think there's also an opportunity for how Heathcote Health can utilise technology to provide services to our people, which I understand the age that may not necessarily be appropriate for everyone. But if I go back and be curious about education, then I think there's opportunity there for education in that space as well. If I talk mental health and how to teach people resilience and
can I pick up on two things there, and whether, Sharon, you want to continue to respond or whether somebody else wants to pick them up. So one of them is resilience. And I know that when I was working with Heathcote Health a couple of years ago on the service plan, one of the things that people told me was that Heathcote's a resilient community. You know, that you've got to, and I even see organisations like the Heathcote Community Capacity Builders, you know, the real interest in the community and consumer committee for the health service, that there's a strength there that needs to be drawn on now to deal with these issues. So somebody might like to pick up that point. The other one's around young people. You know, young people need their peers around them, and you know, it's, you know, some of the sort of social distancing and you know, the isolation that people have gone through. I mean, it's hard enough for adults, but we can sort of say this is only for a period of time, it's for a reason, you know, I can get through this. But particularly for kids who don't have that understanding and don't have the experience to drive on, how's your children and young people been coping, and what do we need to think about for that group of people over the next few years?
I know just from people coming in, it's been a tough year, as anyone with children would know. I don't have mine or have left home, but certainly that's been a huge issue, and there's a lot of concern in our community about children being left behind this year because our internet, we don't have the best internet, as Sharon has said, and it has been a bit up and down. And there are also, in our community, we do have a number of high-risk families. So the children are, I think, have been particularly hard hit this year. So I guess it's difficult for everybody, the schooling has been. But to just divert a little bit with the mental health, and I'm just putting this out there for Heathcote Health, you know, going forward, when we've got lots of money, I think mental health is going to be huge going forward. And I don't know if Heathcote Health have that capacity to start building on a mental health department. And I'm not talking, I'm talking more a day-to-day psychology, psychologists who are available for people in our local area to attend. I don't think we have any or many psychologists who locals can access. I think most people have to go up to Bendigo.
Yep.
I think that is maybe a branch of something that Heathcote Health might look at. But I'm well aware funding is always a big major issue.
Well, and this is where we need to be thinking about partnerships as well. You know, Melanie spoke before very well about the strength of Heathcote Health's partnership with RFDS. You know, there's and I note that you've got partnerships with Bendigo Health, with Bendigo Community Health, and with other organisations. Are there other you know, are there other people we should be turning to at this point?
Can I'm sorry I came in late.
Hi, Sherry.
Sherry, sorry, I came in late. I was late from another meeting. My apologies for coming in later. I'd just like to make a comment in regard to your question about the resilience of our community. I think that COVID has actually shown us that our community has actually been quite resilient during this crisis. And if I can refer to the collaborative partnership that was undertaken with the leadership of the community, Bendigo Heathcote Community Bank and Advance Heathcote Inc., and engaging with Heathcote Health in terms of a leadership role around health matters and keeping ourselves safe and getting information out to the community. and also engaging with our numerous community groups within Heathcote. And I think, you know, the bank funded a coordinator position to be the connecting community point if people were seen to be in crisis, at risk for whatever reason. And I guess the message that was shared was information, exchange of information, which was delivered to every letterbox in town and postbox and mailbox, and to be able to respond in this unusual climate we're in. And I think, and getting the groups to be active to take care of each other. So community trees, checking on each other, checking on our neighbours. And I think, you know, I've lived here for 10 years now, and people have said over that period of time that there were question marks about the resilience of the community. And what struck me was I felt that we were very resilient with leadership and collaboration and cooperation together, and harnessing our strengths to take care of each other. So maybe there's ongoing opportunities for Heathcote Health in terms of the strategic plan and directions, and even picking up on Colleen's points around you know, mental health strategy, that could be a platform that could be utilised, and pulling people together and continuing to look after and take care of each other, and then access people to specialist services, early intervention as required, rather than picking up at a much later point when people might be higher risk in terms of mental health issues. But it was, I think, quite remarkable what a small community did very quickly. It was very locally based, relationship based, and there was a good collaboration and response. I don't know whether other people who are sitting in tonight were engaged in that and involved in that, but I certainly had comments back from people who were not that engaged in the community that were really appreciative of the information about COVID, resources, what was happening in town, where to go to if you needed help. That I think there's some good lessons in there that we could build on.
Anybody else with sort of resilience lessons learnt? The good, the bad, and everything else?
I guess when I was talking about resilience, I was talking about at the individual level and not the community level.
Oh, okay.
As I appreciate, as I appreciate that if a child, I'll use the example of a child as a parent, if a child has resilience and have tools to maintain that resilience or grow it, then the challenges of mental health, they're much more able to deal with what comes their way. So I guess I was talking about the angle of Heathcote Health and what education, what tools can be done to teach people resilience or find what is resilient for them, so that the mental health issues are mitigated or, you know, are not as long lasting.
So
that's where I was talking about resilience from.
So are there potential collaborative early intervention programs or relationships with our early years learning centres and our 2 primary schools? I don't know whether there's activities, there's, you know, much activity between those facilities at this point in time, but is that something that could be a future response?
It could even be providing mental health first aid training for some of your key people in the communities. They can then be connectors into other services. It might be that your local service is based around perhaps peer support kind of models with escalation up to higher level care as you need it. But there's probably some things that could be done at a ground level without necessarily needing a psychologist in, you know, every single day. So it's about how you can give those tools to the community as well, so that they can recognise people that are going to be in signs of distress and have the appropriate referrals. And it's something that, you know, RFTS would be certainly keen to discuss or see how we might be able to help as well.
I was going to say, we had also shared an opportunity with the community for the SAMRI wellness program as well, the Be Well program that was at no cost, given to us at no cost. And that was shared amongst, and that was taken up really well within the community. So it was a Be Well plan that talked about wellness and well-being and resilience. And we have actually done a lot of work in-house here at Heathcote Health on resilience and wellbeing. That was run by SAMRI, the South Australian Health and Wellbeing Institute. So it was really worthwhile. We've done a lot of work in-house with that.
Yeah. So I'm going to sort of reflect back to you, I think, a bit of a summary of that scan. And I think the thing that's really come out of it for me is that theme around resilience, both individual resilience and community resilience. And I think that they're two things that come together well. And you know, and I think that there's some creative stuff there for Heathcote Health to do in partnership with the community and with other organisations to work on that. I think just the economic status of the Heathcote community it sounds like you're in an interesting position, that you've got some of those opportunities and that sense that, you know, with people coming in, with the assistance that's been given to the wine industry, that you've got the potential to come back pretty quickly and pretty strongly, and that will be a real tool for the community to use, you know, to keep everybody connected and engaged. And I think some of the real basics around for the challenges for Heathcote Health is just around dealing with people's sense of fear and disquiet, whether it's about you know, the basics of infection control and keeping people safe as they go, you know, as they're in transport or coming into the health service, as the health service is coming into their homes, you know, responding to people's needs promptly, providing information, providing those links. Before we move on from this, can I ask you a bit about your older community within Heathcote? One of the things that's very clear with your current population trajectories is the forecast of there being more older people, or the older cohort forming a greater percentage of your population. How do you think older people have been travelling through the pandemic? Are there things that we need to be thinking about? There's also the Aged Care Royal Commission, which will put out a report early next year. Are there issues that we need to bear in mind thinking about the older community?
Can I just add one thing?
Yep.
That we haven't, I'm representing Uniting Church, we haven't really looked at the spiritual needs of people. And we're made up of body, mind and spirit. We're very good with the body and the mind, but we seem to neglect people's spiritual needs. And I think in a pandemic, people are asking questions, what's life all about? You know, what's the meaning? What's going on? And we need to have a way of being able to help people think through these things.
Yep.
Now, also, I think for a lot of the older people, they've been cut off by their lack of technology.
Yep.
And I know as a church, we've been streaming worship and we've been streaming a whole lot of stuff, but some of our people can't access that. And that's been an issue, and they then feel very isolated. So I'm just sort of wondering if there are ways in which we can really start to help people, maybe giving them reflection places where they can go and just reflect and give them resources and things to think about. I'm just sort of raising a whole lot of ideas there.
Yep.
Alison, I think you've got quite a diversity in the ageing population in Heathcote.
Yeah.
Economically, socially, where people live. You know, there's a lot of people that live out of town that might have, as they age, might have different issues to people who live within the township or close to the township. I think it's quite a diverse and challenging population of people. And I don't know whether we know a lot about them. we know the census data, but I don't know whether we know a lot about who they actually are. I mean, I belong to an ageing population of tree changers that came to Heathcote. So, you know, I think there's quite diverse groups of people in that cohort that probably have a lot to contribute, you know, back into Heathcote Health and into the broader community. But I don't know whether there's a connectedness to that wide range of people. I mean, the other point I'd like to make here too is I'm a member of Advance Heathcote Inc. and the Dementia Village will also have another impact on that ageing cohort. Advance Heathcote Inc. Has been working for the last 12 months on trying to progress the Dementia Village to get an operator and an investor. And the COVID put a spanner in the works, and we haven't really been able to engage with particularly the operators because of the challenges that they have in terms of their safety of their residents and those challenges. But should that project eventuate, there's another level of ageing people with specific needs and a specifically purpose-built facility that hopefully can also offer back to the community.
And my understanding of that model is that facility is very, very deeply grounded in community.
Yes,
that the village is not the building, it's the whole community.
It's the village is in the town, it's in the region, so it's a micro town within Heathcote. And there's a fluidity and a seamlessness between. It's not walled. It's two-way process.
It's a really, really fascinating model.
Yeah. So we haven't given up hope. We're sort of hoping with the changes to the restrictions and things like that we can hopefully get some discussions and dialogue going with some possible operators. And we've given ourselves 2 years to sort of really give it a good crack. And I would think too that perhaps that part of that environmental scan is to get Heathcote Health back engaged in that process. I mean, it's been handed over to Advance Heathcote Inc. to sort of keep it going, but it would be really good to have Heathcote Health, back in that process. So it came from that ethos. It would be great to, pull that back in again.
Just before we go on to the a quick reflection on the existing strategic goals, I understand that there's a few people here out of the business community in Heathcote. Did any of you want to comment on sort of, those issues we were talking about, the employment prospects and what the Heathcote community is likely to look like over the next 4 or 5 years? Have we covered that enough? Is there any other intelligence that you've got? So I think that means you feel we've covered it enough. So just if you do sort of think, there are other of those sort of economic employment issues that we need to take into account, because they're things that we can't get from other sources, sing out or put it into the chat conversation. So if we think about the things that Heathcote Health has had as its strategic goals for the last 3 years, I'll start by saying, do people here who are part of the Heathcote community, do you feel that, as you've worked with, watched, been part of Heathcote Health, that, that they've been working towards those strategic goals? Do you feel that they've been, a guiding light for the health service?
Alison, can you hear me?
Yeah.
It's Tony Hunter, Alison.
Hi, Tony.
I was a bit slow in picking up on that last session, but it certainly is. It's a growing population.
Yep.
I play golf here. I own business here, and from the wine industry's point of view, we're just waiting and hoping that we can open our cellar doors and generate some traffic through our cellar doors and generate some income.
Yeah.
And that's all going to happen, and I think everybody's gearing up for that, and I think we're going to get absolutely rushed when the doors are open.
I hope you get absolutely rushed.
Yeah,
that would be fabulous.
But just playing on that population point that you were making, it is a growing population, not only just from a tourist point of view, but I mean from a permanent living point of view. The golf club has never had so many people playing golf on Thursdays, Saturdays. We've gone from probably 20 or 30 up to 50 and 60 players every weekend now. So that's growing. It is though, and there's a lot of people moving from Heathcote, some permanently, others who have got a holiday accommodation up here. And they're becoming more inclined to spend more time in Heathcote.
Yep.
But we are talking people in their 50s, 60s, and 70s. So we're not attracting any young people to Heathcote.
Yep.
I see the dementia village as a major tipping point for Heathcote, so I think it would be wonderful if that was to advance. And that tipping point involves a lot of additional employment in Heathcote, and that employment will be through a range of ages, from 20-year-old, 30-year-olds and onwards, who are engaged in the health issue and healthcare. And the dementia village is going to employ, probably upwards of 100 people directly.
Yep.
And that is going to change the mix, the age mix, I would have thought, pretty substantially.
So that's...
Go on. Yes, I'm finished.
So, no. It's an interesting point. So Heathcote Health is one of the major employers in town. I think we've got someone here from Mandalay. Are you another major employer? So just thinking about, if the dementia village ends up, if you're right that it's sort of 100 employees more or less. I'm not quite sure how many are at Heathcote Health, but the dementia village would become one of those other major employers. Who else are the major employers?
Prestige Trailers, the trailer making company, is a major employer. It's on the outskirts of town, going to Kyneton.
So and I think, Tony, where you're going is that Heathcote Health's not just a health provider; it's also one of the major employers and has a responsibility within the community that drives from that. But I think that if the dementia village is going to be that large with that many employees, that's a significant. It becomes a significant partner to the size of Heathcote Health as an employer and a service provider in the community.
It does. Tony, if I could comment, there is actually a growing number of younger people who are coming to live in Heathcote, and the game changer for that has been the childcare centre, because we were getting anecdotal information that people saw Heathcote as a fabulous place to come and raise your family, a young family, but when they inquired whether we had childcare, that was a thing that sort of said we have to be in a community that has childcare. And I think from my knowledge of the primary schools that their enrolments have increased. The kindergartens full. So there's, you know, a trickle of young people coming into the community, which is really pleasing, you know, in terms of the ageing demographics to sort of balance out the demography. So, I mean, that's something that's probably happened in the last, you know, 12 months. So the next census data would be very interesting to do the comparison of what the impacts have been in that younger age cohort.
And that's really interesting because we've obviously got access to the census data, but that's, you know, the last census was now a few years ago. So, you know, things change. And sometimes you can't find that out except for by having these conversations. Interesting. So I'll just quickly bring us back to the strategic goals. Does anybody have comment on the effectiveness or usefulness of the current ones? And I'm not necessarily sort of wanting to say, let's spend time, you know, analysing the past, but it's just in terms of as we're starting to think through moving from a point where these are the strategic goals, how are they likely to change over the next period of time? Is it a fundamental change? You know, is there a core within what's currently there that remains important and that you'd like to carry through? A new plan shouldn't, you know, we don't want to throw the baby out with the bathwater. If these things are important, they need to be maintained in some way. So I suppose my question is, what's important to you from the point of view of Heathcote Health, and, you know, what can we take from the existing strategic priorities, but what needs to be changed and developed?
Building. I guess number 3 is pretty critical, isn't it? Services are strategically planned and delivered in line with demographic and health projections. I guess it picks up on what we've been talking about around the changed demography and the needs of ageing people or younger families, resilience, those sorts of things, family resilience, resilience of young people and children. I guess that's your sort of, I guess your starting point in terms of your raison d'etre of your services. The others seem to follow in line with that. I'd just like to make a comment in terms of increasing community awareness and engagement. And I know in my conversations with Dan, that's a sort of constant challenge. And I still meet people in the Heathcote community that really don't know much about the services of Heathcote Health, particularly if they have their medical GP or medical treatment in Bendigo and not locally. I mean, you know, people used to be quite surprised that we had a helicopter landing pad. Stuff like that, you know. So I think that's always a challenge about how you keep information out there, you know, at the coalface in the community so that people can use services or identify unmet needs.
So do you feel that people trust that, you know, even if they don't quite know what Heathcote Health does, that if they had a question, they'd trust that Heathcote Health, if they went to Heathcote Health, they'd get the right response, even if the right response is, gosh, we think you need to go to Bendigo, you know, but that's part of what people need to know. Is this something I can deal with here, or do I need a referral? Do you feel that the health services got that level of trust? Do people know how to get their questions answered, how to get into the system?
I think people who have accessed Heathcote Health I personally have not heard of any bad reports, and are always quite amazed at the standard of service from Heathcote Health. Having said that, I think there still is a large amount of people around who, as Sherry was saying, who would go to Bendigo first.
Right.
As opposed to going up to our local hospital, they would drive to Bendigo.
Yeah. And I mean,
I think a lot of people are still doing that. And that again comes from people who who've been here for a little while, and maybe, I don't know, historically, maybe Bendigo was the place to go.
Yeah, because I mean, as a small rural health service, a hospital like Heathcote Health plays a very you know, sort of a unique role in a rural community, in that you know, they need to be the point where people can enter and get access to the health service system, you know, where somebody could just turn up and say, I feel peculiar and I don't know what to do. And they're going to be, you know, they're going to be looked after, they're going to be informed, they're going to be serviced and potentially assisted to go to another health service to get what they need. But as a small hospital, they can't do everything. So there's, you know, we talked before about safety and quality. You know, they need to stay within the level of service delivery that's safe, that they know they can deliver effectively and high.
I think Heathcote Health do seem to have a very good triage system, and they use their telehealth a lot, and they use it well. So and that goes back to my comment about people who have used it seem to have had positive experiences. And that's just from my point of view. I don't know anybody.
I'd reinforce that, Colleen. I've had some experience with Heathcote Health in terms of an aged mother, you know, with crisis health issues, and exemplary triage and services and responsiveness. And I hear lots of stories of people who present after hours or emergency with you know, something unexpected, unanticipated, and have nothing but positive comments to say, so high quality service and trust, and you know, no complaints. I've not heard any complaints about the service people have received.
Yes, I would tend to agree with both Colleen and Cherie. I think there's going to be a massive role for Heathcote Health going forward in that telehealth area, and particularly monitoring people's health remotely in their own homes. I think that's a huge growth area, and the technology is getting very clever now. And it is possible for doctors and clinicians to monitor people's health remotely. And there is a preference, I think, going forward for older people to want to stay in their own home and their own accommodation. I think going into a nursing home is an absolute last resort for most people. And going into even a retirement village scenario, I think, is not desirable. I think there is going to be an increasing desire on ageing people's behalf to want to stay in their own home and be monitored in that scenario, have their health monitored.
Yeah, and you know, even just thinking about what we're doing tonight, of bringing together a reasonably sized group of people who are all geographically distant, one of the things that's coming out of some of this telehealth area that's particularly been pressed pretty hard in over the last couple of months is that you've got your local clinician, your distance clinician, and your patient all in the same conversation, but not necessarily in the same room. So you can have your local clinician with your specialist, who doesn't even need to be even in Australia if the right one is overseas somewhere rather than here. So I think there's some very creative things that can be done. And I think you're right, Tony. It's the whole direction of service provision for older people is that health services come out from behind their walls and they're active in the community. And what's at the hospital campus is the hub. It's the resources, it's, you know, where people go to reconnect with their peers and to get re-resourced to go back out into the community. And I think that you've put your finger on it, that's one of the I think it's one of the strategic challenges for the whole health system, not just for Heathcote Health.
And I think strategically having people in their homes, which is a good thing, and there's a lot of evidence to suggest that, keeping people in their own homes for as long as we can. But with that, then I think we've got to be very aware, and I guess this is Heathcote Health, where Heathcote Health comes in, is that they don't become isolated.
Yes, absolutely.
And that's a huge.
Yeah.
One of the interesting things they use in overseas is actually telehealth-based systems for social connection. So they might have lunch groups that meet up with each other, and they've got a nurse that will check in. And, there is a way to kind of promote that. The other comment I've got around digital health is, while the technology is fantastic, it does depend upon people perhaps having a certain level of digital literacy.
Yeah.
And you can have a great system in place, but if people aren't supported to use it, that can be really difficult. So it might be having a concierge service to make sure people can connect through to their appointments. So it goes beyond the hardware and the connectivity issues. It's how do you support people and increase their knowledge about it.
Yeah, and it's not a replacement for face-to-face. I think well used, it's an enhancement to face-to-face service delivery.
And I think that's exactly right, Melanie. And that's one of our problems, I think, locally. We do have Heathcote Health are great. Their community nurses go out and they do check on their patients, but I think we need to do a little bit more sometimes in trying to connect those people.
Well, it leads me to think about the development of future services like home visitation by volunteers.
Yes,
they've been around. They're not new. They've been around for a long time.
Yeah.
That you may be able to recruit people from within the community to sort of have that extended taking care of each other by dropping in.
Yes.
Going
and you nominate people, so they have a group of people that drop in on.
Things like the library service could have drop off books to people. If you can't get to the library, there's a whole range of ways that you can take service to the community. I mean, picking up on Tony's point around ageing in place, there's, I guess, a whole issue of where we've got 100,000 people now waiting for home and community care packages. I don't know how that impacts on Heathcote, but if we've got an ageing population and we want to keep people in their home, what happens if you can't get the resources and so I guess there's potential partnerships and relationships to advocate as a community for those resources with Heathcote Health in our community. So there's some interesting ways that, there's a lot of youthful older people here that could be visitors if people move from the city, because a lot of us come from the city and come away from our resources. We have to reconnect and make new friendship groups. So, there's some interesting ways that we can support each other.
Yep.
We have, as volunteer coordinator of Heathcote Health, we actually have community visiting schemes. So we actually
I didn't know about that.
Volunteers.
There we go.
It's a little different at the moment, and we've been connecting remotely via FaceTime and Zoom and that sort of thing. But there actually is a program for community, so to reduce community isolation with our volunteers, and they have some friends that they visit often, or there's new people. But they have some really good relationships, and also our Meals on Wheels volunteers. They're seeing people regularly and they're noting any changes, and they always come back and they give a bit of report to the community team, and that's sort of our community home packages, so our community support as well, so the cleaning and that sort of thing, but also to the district nurses to note, perhaps someone's not feeling well this week, they didn't answer the door when I went there to drop off their Meals on Wheels. So we have some good, but that can definitely improve. I'm always after more volunteers.
Thank you. I didn't know about that service.
So that sort of possibly brings us on to the last group of questions that I wanted to ask you, which is about resources, and obviously volunteers, human labour, and human input, that's a key resource. But if we're thinking about, and we've talked about, the potential for not just Heathcote, but the Victorian community as a whole, to be a bit skint over the next little while, as high unemployment starts to hit, as people's incomes decrease. Where are the sort of places where we should be thinking about, creative use of existing resources, doing better with what we've got? What does Heathcote Health need to be thinking about? Because obviously all this stuff's a two-way street, that Heathcote Health draws on the community for access to volunteers, for access to information, for connection, for using your networks to get itself out, further into the community. What do you need from Heathcote Health to keep working on these issues together?
I think Heathcote Health has given great leadership to the community around community health and wellbeing issues.
And leadership's a key resource.
Yeah.
So it's an interesting spot for you to start. Yeah.
Yeah, and I think in the 10 years I lived here, I've seen dramatic changes. I mean, quite exponential changes for a small rural hospital, community hospital. Extraordinary stuff, and I think we're very lucky to have what we do have here, and I think that's only come through strong leadership, strong strategic governance, and creative management and collaboration with numerous partners, both in town and externally out of town. Because Heathcote doesn't operate in a vacuum. It's connected to Bendigo, Loddon, for resources, policy, influence, and contributing to policy. It's a two-way process in terms of our Heathcote wellbeing and the greater wellbeing of the region. So I think that's really critical, that leadership role continues, and it's been a very responsive leadership. And I can go back to the COVID-19 Community Bank initiative. Heathcote Health stepped up instantly, as seeing it was a role that they had to play, and were fabulous in that.
Yep. It's interesting that you talk about the relationship external to Heathcote as well, because that's another area where you see resources, is those partnerships that get brought in, and the leadership of actually building those networks is important. That's a very interesting point. So is that something that you'd really like to see as a key direction for Heathcote Health over the next period of time?
Well, in terms of the competition for resources, I think we've got to keep connected and out there. I mean, I know Dan also has a very intense, positive relationship with the City of Greater Bendigo local government, as well as a whole range of other health partners. So I guess it's probably critical for that to continue. I would think that would be one of my comments, because I don't think we can operate isolated. I think one of the things that we've probably learned is that some of the silo walls might have crumbled during this COVID crisis, that it's a good opportunity to keep them down, to keep working collaboratively and in partnerships. There's opportunities, I think, that are there, and we've got examples anyhow of the Royal Flying Doctors projects and many other projects, and the relationships also between service delivery and evaluation has been really critical, and I think that's another resource that's come into this community from universities and tertiary institutions that have been able to give us back evidence-based benefits and driving service delivery. And then there are other resources that can contribute. It's a two-way process, and I know we've had a lot of student engagement in terms of doing some of that research. So I would think there ongoing resources to keep around the table.
Yep, yep. That's an interesting point you make about some of the opportunities that arise because of the pandemic. And you pointed to, the silo walls crumble. That gives us an opportunity to really do things new and different. Are there other opportunities that other people have noticed in that same way, that there's things that have come out of, what admittedly has been a really tough time, but maybe it's opened a door to something new and something better?
Tony Hunter again. I don't know that you can talk about a strategy going forward for Heathcote Health without highlighting the impact that something like the Dementia Village is likely to have on Heathcote in toto, but particularly Heathcote Health. And I think Cherie would know better than I, but if it's likely to happen in the next sort of 3 to 5 years, that's got to be factored into Heathcote Health's strategy going forward, because it is going to have a massive impact.
Well, they'd be our preferred service provider, Tony.
Yes.
In terms of, medical care, GP medical care for residents.
And training and
the long-term dream is to have a research hub and training. So, there's ongoing opportunities and partnerships and relationships there.
Yep.
I agree with you, Tony.
Yep.
And it's not, the site is, within walking distance to Heathcote Health. So again, it's part of that seamlessness and integration with the community. It's not like you've got to get in a car or be taken off somewhere. It's, just you might borrow some of those little golf carts you've got out at the at Heathcote Health at the golf course, Tony, and have it in the centre in the facility. Just chug down the road. But yeah, it's a fabulous range of opportunities.
Yeah, absolutely. Anything that's happened during this last little while, that's really revealed a weakness, or something that you'd say, and I'll shamelessly steal from New Zealand and talk about building back better, that, are things that really need to be left behind, that you sort of think, the pandemic challenged us, and this thing we've discovered is not useful to us and we need to put it aside?
It's Anne. Rather than things we don't want to do, I'd just say, we can just advocate for the maintenance and increase of telehealth. That's just been a genius addition to health services. And we've got to not let that slide back into, oh no, you do actually have to present, and expanding, not just maintaining that, but expanding it to its fullest potential.
It's interesting, isn't it? Because people have talked about telehealth for decades now, and at the beginning of the pandemic, how long did it take? 2 weeks, I reckon, that it took from all of the reasons why it couldn't work to, yes, it's working. How about that?
And there's already word about how they're trying to start pulling it back already.
Yeah, I agree. It's like we were saying, it's not necessarily a replacement, but it's a very, very good enhancement to everything else. So we're nearly up to the end of the time you've given me. So I'll now just say, is of anybody that's here, was there something that you wanted to say when you came to this meeting, and I just haven't asked the right question that's given you the opportunity to say it?
I guess I've got one question. This is maybe part of the strategic directions and the new strategic plan, is that it would be interesting to know what Heathcote Health would like from the community. We're contributing, but question. Is there something or activities or whatever, I don't know what it is, that Heathcote Health would like a contribution from the community that would benefit health service delivery and wellbeing.
I suspect that's a question on notice, unless one of the board directors that's here wants to address it.
I mean, top of my list, of course, would be a local fundraising group, maybe with a fabulously strong
auxiliary or something like a hospital auxiliary fundraising. I mean, for large sums of money. I'm not talking about, you know, beer and skittles, but, you know,
a local fundraising committee, or I mean, I know there was already op shops in town, but, you know, another revenue stream to do some of the nice to have things.
Well, you have, I know, in other rural communities, you have Red Cross committees that fundraise specifically for the hospital. And
there are op shops for specifically fundraising committees. If you were to ask me, but that's me by myself.
I'm interested, you know, whether there was something specific.
Yeah, I think it's a good question as part of this, and I'll put that challenge back to the health service as we go through the process that I'm running, you know, for them to be putting their mind to that. It's an interesting question.
This is a rhetorical question, Alison, but are there any areas that Heathcote Health is involved in that are really under the pump? You know, are there bottlenecks? Are there areas that are really stretched?
I'm afraid I can't answer that. Is there anybody else who can answer that?
It's Anna. I mean, I think across our services, we're doing well. I mean, we've got the three businesses, as it were. We've got our acute urgent part of the hospital. We've got the community outreach where we're going out, and we've got the aged care service. And each of those, I think, are, but then I'm biased, are doing really well. It's getting those other services that aren't part of our core support into town, to provide those other services like you're talking about in terms of mental health or allied health services or specialist services, and negotiating the partnerships and to bring those important services into town. It is an area that we've worked incredibly hard on over the past 2 years, and we've been successful at. But that's where I see there's potentially more need. Does that answer your question at all, Tony? Or
yes, it goes part of the way there, certainly. Something like aged care nursing beds. Is there a critical shortage that you've identified in Heathcote for aged care nursing beds?
We would like to put on more beds, certainly, but we run at a very full occupancy, but our waiting list isn't that long. But we would certainly like some more beds there, and of course that has to play in with the dementia village as well, and
with increasing services in the home.
Indeed, and as you identified that trend for people to stay in their home for longer. Sorry, Cam, you were going to say something?
No, that's right. I was just thinking, given that we're projecting growth in the population, I guess we should be also thinking about scalability in the near to mid future of all the services that are provided.
That's a good point, definitely.
Yeah, if you're already at sort of capacity and we're expecting a lot of growth, we probably should be thinking of that. Yeah.
Yep.
I haven't been paying much attention to my emails lately because I've been busy with other things, but did I see something come across my desk about a specific Heathcote health and wellbeing survey? Yeah, is that right? So obviously the results of that will be really important for your strategic directions. They'll feed into that. I don't know how long. Who's doing that? Is that local or is it City Greater Bendigo? I'm sorry, I'm a bit out of the loop with that.
That's all right. We're partnering with the Heathcote Community House.
Right, okay.
They launched the wellbeing survey. I can also, you may have the link already then, but we can definitely put that up on our Facebook and put it on the website as well for everybody to access?
No, I just got something sent to me with a link to the survey, and I just had a quick scan of it. So obviously the results of that will be very interesting and can feed back into, I guess, the last question about the relationship and unmet needs and things like that, and perhaps, you know, potentially more services that might be identified as a need. I'll say, my last thing I'll say is I would really like to see Heathcote Health become re-involved in the dementia village proposal.
Yeah.
It'd be great to have them back around the table. And I'm also wearing my advanced Heathcote hat. It was always fabulous when Dan hasn't been a member of that committee now for the last 6-8 months. And what I always felt with Dan's contribution, it was a bit like taking the temperature of the town.
Right, okay.
We got the hot spots and the issues. I mean, our community plan is a 4-year document, but it can be responsive to advocacy, new needs, things like that. And it was a bit like, you know, the temperature. I got a sense of what the temperature was in the town when Dan was attending those meetings to talk about, you know, hotspots or new trends, challenges, those sorts of things. And there was a fabulous, you know, collaborative partnership with, I mean, we still do have that with him, you know, he's not a member of the committee, but it seemed to pull together a very holistic approach to viewing the community.
Yep.
In terms of what the community identified in its community plan. And there was a lot of health wellbeing issues in the community plan. There was a crossover, but I think that's something that would be good to, you know, re-partner again in that space.
Okay, so last call for final comments before I finish my bit and hand back to Anne.
Yeah, sorry, I've been, it's Callum right here. I've been sitting quietly in the background, but I think it seems you've hit on most of the main ones, the issues around technology, the opportunities provided by telehealth. The only one for me is probably then, and I saw it mentioned on your paper, just the workforce and the talent, which may actually be more virtual rather than necessarily having to live local. But I think the comment before about scalability, it's probably some of the partnerships that bring that workforce. And whilst telehealth helps attract specialist skills and those sorts of things, I just have a suspicion that every small community is still going to be targeting a small amount of those talented professionals. And I think probably the key role for Heathcote Health is being able to, I don't know, for the community, but provide the trusted advisor. In the telehealth world, there's probably likely to become a lot of avenues you can connect with, but who are the really good ones, and who are the really good ones where the health service can engage with local people and perhaps help coach or support those interactions along the way.
It's an interesting point. So the health service becomes part of people's connection with the telehealth world.
Yeah, perhaps almost crudely, but almost the broker and the trusted broker at a local level.
Yeah.
Just wanted to add to that conversation around workforce. A lot of what we're hearing up in Northwest Victoria is around delegated models of care. So, for example, using allied health assistants within health services and training them up to work to a higher scope of practice with supervision from an allied health professional who might be remote or might provide a visiting service. But that's certainly emerging as a way to build a sustainable workforce and also allow people within the health workforce to work to a higher scope of practice.
Yep. It's always the issue for small towns is somehow or other you need to find real jobs for real people, and particularly for small health services, you know, you get a bit of funding that'll hire, you know, 0.8 EFT of a physiotherapist, but it's hard to attract somebody to come and live in town for what's a sliver of a job. And I think maybe it was you, Callum, talking about how do you come together to make those jobs real for people.
Yeah, I think worse still, I probably hear partially representing Bendigo Community Health Services, who I think has more to do, particularly in that allied and primary healthcare space with someone like Heathcote. I don't think we quite do that well enough. I'd better be careful. I know my boss is on this call too, but I think there is room for us to improve, and particularly around that model that was just described. But it's, even in our workforce context in Bendigo, we get funding for 0.6 of a physiotherapist. Try filling that role. No one wants half a job.
Yeah. Okay, so as far as I'm concerned, this isn't necessarily your last opportunity to be involved in this conversation. As I said, there's a second one of these workshops tomorrow. There's no expectation you come to 2 of them, because that's a big call on your time. However, anybody who wants to, you're very welcome. You can also go to the Heathcote Health Facebook page to contribute. And we were going to ask, would anybody object to having the recording of this conversation put up as a link on the Facebook page?
No.
So we'll take it that nobody objects. But if you go away later and think, actually, I do object, then please say so. So thank you all very much for what's actually been a fascinating and really useful conversation. The online thing isn't easy. It's easier in person, but you've done very well, and I really, really appreciate your input. So if I could hand back to you, Anne, to close up, that would be great.
Thanks very much for that. And thanks very much, Alison, for that fabulous facilitation. I think you've done a great job there.
Thank you.
And thank you, everybody who's taken the time to come along this evening and contribute. I've been really stimulated by some of the great suggestions and ideas. It's really fabulous to hear back from our community, and be assured, this is for real. We are taking your ideas and support, and we're building them into our strategic plan for the future. And what I heard, and I'm sure that Michelle's got better notes because she's a ninja note taker, but I heard some really interesting themes emerging there around the resilience of the community, and how effective that can be and how we can support it, around mental health concerns and social isolation concerns in terms of sort of fear and uncertainty. But that there's some partnership opportunities, and that our communities really wanting Heathcote Health to still take a lead and be innovative and maintain our leadership in the space. I particularly liked the comment, do not ask your health service what would Heathcote Health like for the community? And I thought, don't ask what you can do for your health service, but what your health service can do for you, or is it the other way around?
Yep.
So those are some of the main themes that I heard, and I'm sure that there's a great opportunity for us to build on them, and appreciate all of your time and input this evening. So thank you very much. Unless there's anything else that anybody would like to say. Oh, Cam, did you just want to say something there? Oh, you're waving goodbye. Oh, I thought you were like, no,
I was waving goodbye, yeah.
All right, and thank you to my fellow directors and Michelle for organising everything. And I'll say good night and farewell. Thanks very much.
Good night, everybody. Thanks so much.
Thank you. Good night.
Good night.
Good night.
Good night.
Good job.